I was sexually assaulted, but my daughter was raped by 4 men in our house. We were taken to St. Vincent's Center of Hope. I don't remember a whole lot after we got there. My daughter does. She remembers everything, and she was very scared. She was just so frightened at that point.
A Center of Hope is a location of care where patients of abuse, sexual assault, neglect can come to get care in a place that is calm, safe, secure.
Well, the name really speaks for itself, but it's a Center of Hope. They will receive access to a medical exam and forensic evidence collection and preservation, of course, of that evidence.
Registered nurses can continue their education to be able to perform comprehensive medical exams. This is called a sexual assault nurse examiner. SANES receive training in regards to forensic medical exams, as well as collecting and obtaining evidence that will be turned over to law enforcement and testifying as an expert and fair witness.
One of our roles as the physicians in the Center of Hope encounter is to assess for those physical injuries and to treat those at the time of the visit. In addition, we address issues such as post-exposure prophylaxis for sexually transmitted infections. We can counsel about emergency contraception and deal with some of the other physical or medical components of their trauma.
We had a SANE nurse, a sexual assault nurse, with us the whole time we were there. And my daughter had an advocate who came in very quickly to help work with her and talk to her and make her feel comfortable. And then our detective came there as well, and he was so professional and so compassionate. So everything was done right there and then. We didn't have to think about a thing. It was just really a godsend that we had the Center of Hope.
You think about a woman that comes into the emergency room and is telling you that she's been sexually violated. And having a Center of Hope allows you to take care of her in a very kind manner, but not just that, in a way that we can collect evidence that allows it to be submissible in court. That is a really big deal, to have the ability to know that evidence collected is collected in a manner in which the courts will accept it.
Overall, sex crimes represent about 50 to 60 cases annually in our jurisdiction. We are rather high for our size. And these types of crimes, it's one of those things where as we do more informational things like this, more and more of those cases become reported.
The victims in these cases, a lot of times have probably gone through the most traumatic thing in their life. And with the Center of Hope being available locally in Boone County, not only helps the victims, but also law enforcement from an investigator standpoint, and having the resources on hand at the Center of Hope, whether it be victims assistants or the investigators or the nurses or the doctors, to help them through that process, try to make that a little bit easier for them.
I think that from the work that I've done more as a volunteer, really almost than from back in the day that we were going through all of that, I have seen the devastation when somebody doesn't have a Center of Hope to go to, and then they're told to go maybe, off somewhere else, far away from where they are, where they're living, and so they don't do it. They don't follow through. It's too much trouble. They're too traumatized to do all of that on their own. I think it's just absolutely critical to have a Center of Hope available for people close enough that they can be there right away. It's just critical.
There are a lot of costs associated with bringing the Center of Hope to Boone County. There are a lot of resources that are going to go into constructing an existing space at our Anson location and converting that into a soft space where a patient can feel comforted, to an exam room where she can have her forensic exam room, as well as a private restroom with a shower. There are a lot of resources and costs associated with the construction alone, plus all of the state-of-the-art equipment that it is going to take to collect evidence and preserve evidence. And then one of the most important resources of all, staffing. There's costs associated with that and their training. It takes a specialized nurse who is a sexual assault nurse examiner. Luckily, we are so thankful to have been able to partner with Sylvia's Child Advocacy Center, and they stepped up and are willing to help with some of the training associated with these specific nurses. And so we are so grateful for that, and we are also very thankful and grateful for the Boone County Commissioners who have stepped up and pledged to help us financially with this project. But we're not done. Like I said, that's a huge cost associated with getting this program off of the ground, and we need the support of our community.